second of my health shows at Revive FM, and I'm absolutely delighted to have today with me Dr Yasin Fatine. Assalamu alaikum wa rahmatullahi wa barakatuh.
I'm really excited. I know this is radio, but I'm excited.
That's good. So essentially today's show is going to be a bit of a different one than what I normally do. So essentially the aim is still there. So our aim is to get out important health messages which are important for the public right now. And if you have any questions that you want to send in, you can do it through our Facebook stream. You can do it through the studio number. So that's 0333 444 0940. That's 0333 444 0940. And yeah, just send me a message instead, and we can try and answer as many questions that you have. And it's essentially for everyone. Any medical issues, call in. And the other thing I want to concentrate on today is the fact of students, prospective students who want to apply to medicine. I'm sure we can give them good advice as to how to get into medical school, or even medical students and foundation year students who want a bit of advice from Yasin, Dr. Yasin Fatine, who's been through this process, and whether they could help, whether he could help them in any way as well. Whether that's even the smallest of questions, we'll be more than happy to take them. So before I start, I want to introduce Dr. Yasin. So Dr. Yasin Fatine is in his second year of his pediatric training program.
First.
Oh, sorry.
Yeah, first.
Sorry, yeah. First year. He'll start second year in September, inshallah.
If they let me.
So he's in his first year of his pediatric training program. He qualified as a doctor in 2015 from Barts and the London School of Medicine and Dentistry. He also has a BSc in global health. He's got a postgraduate certificate in medical education. In his free time, Dr. Fatine enjoys Pokemon Go. And from his recent Instagram post, you can tell he really enjoys traveling as well. He also holds a Quran circle every week in West London, and that's one topic we'll touch on near the end of the show, because I think that'll be quite interesting. How are you, Dr. Fatine, today?
Yeah, very good, alhamdulillah.
How's Ramadan?
It's great, alhamdulillah. The hunger's not really getting to me, it's more the tiredness.
Yeah.
Just, I think everyone's feeling it, but alhamdulillah.
I think it's the lack of sleep that's the biggest issue, isn't it?
Yeah, just because I go to Tarawih in kind of near central London, and I live in Luton. It's just I get home late, I start work early. Yeah. But alhamdulillah, it's good.
Yeah, and I think in this month, Ramadan's one of those months where instead of complaining, you're like, do you know what? It's Ramadan. I'm gonna make the most of this.
Exactly.
And yeah, I think that's the barakah of Ramadan, essentially, isn't it? So, how are you feeling about your first radio show?
It's great. Yeah. You can't see the excitement on my face. Oh, actually, there are cameras here as well. But I'm actually quite buzzing.
Okay.
We've only got an hour.
Yeah.
And by the way, if I'm talking too much, just like
sure.
Shut
I'm sure no one might.
Okay.
You're the guest today, so all the talking's up to you.
Okay.
Okay. So I'll start off by essentially. I just want to know about how you got into medical school and how your journey through medical school went. Because obviously, I know it's been nearly 4 years now since you graduated as a doctor.
Yeah.
But how was your journey getting into medical school? Because a lot of applicants are going to be thinking about that. How did they get in and stuff? And how was medical school?
Okay. So I think I was quite a late bloomer when it came to deciding if medicine was for me. It was in my GCSEs. I actually wanted to do psychology in year 10, year 11. And I went on a school trip to Cambridge University. And I asked the guy giving the tour, do you do psychology here as a degree? And he said no. But we do medicine, and you can do an intercalated degree as part of your medical degree, so you can do an extra year in psychology if you really want. So I thought, okay, let's look into medicine. And I thought I liked it. I did work experience in it. Plastic surgery at the Royal London Hospital.
Wow.
I thought this is quite cool. And yeah, I just took it from there. So I applied. Obviously, I applied to Cambridge the first time because I was still buzzing from that from that school trip.
Yeah.
Didn't get in, even though I had a few interviews. Didn't get in, so I took a gap year. I thought I'd try again. Didn't get in again. So I got into Imperial Biochemistry. So I thought, you know what, let's just start this degree and see how it goes. But I applied to medicine at the same time. But something I do have to say is, even though I didn't get in the second time, I think that year at Imperial was probably my most enriching, probably one of the best years I've ever experienced, because I've met so many friends in that year, and I'm still really close friends with them. I've been traveling with them, and some really nice people. Alhamdulillah, I got in the third time to Queen Mary, or Barton, London, which we like to call it.
Yeah.
And that's where I met you for the first time. Alhamdulillah, it was amazing. I'm not really an academic kind of person. Obviously, I've got through the exams. I don't know how. Alhamdulillah. Maybe it's my revision technique. I just know what they can ask questions about, what they can't. But I really did a lot of extracurricular stuff and made loads of cool friends and stuff.
Mm-hmm.
So what I would say about anyone wanting to apply to medicine is make sure you have the passion for it, because I know there are a lot of external factors that, you know, you've got parents who are maybe pushing you to do medicine, or maybe societal pressures.
Mm-hmm.
If it's something that you probably won't be enjoying, don't go into it, because I've got loads of friends and colleagues now who have been pressured into it and have graduated as doctors, and they really hate their jobs. They can't wait for their next day off and things. And I know the job is arduous and things, and we all need our time off, but they don't really enjoy it. So if it's something else that you enjoy doing, I would say pursue that. Maybe talk to your parents and convince them that maybe you enjoy something else. Alhamdulillah, I've had parents who didn't really push me in a certain direction. They just went with the flow and supported me whatever I did. And yeah, I owe them everything, to be honest.
MashaAllah.
So other tips I would probably recommend in terms of getting into medicine, if you really have decided medicine is for you, is secure work experience very early on, because I know it's quite difficult, especially if you haven't got any personal contacts in the medical field. Really take the initiative and email doctors, email hospital work experience coordinators, because every hospital has some sort of system where they get work experience students, and really hound people to get a placement, even if it's a few days or a week.
And essentially use your contacts. That's the biggest thing, isn't it?
Yeah, that. I think most people have gone through that way.
Yeah.
So yeah, really try and find work experience, and that is really the thing that will tell you whether or not you will more or less enjoy it. What I've always believed is that even as a medical student, you're really never going to know working as a doctor until you're working as a doctor. Even when I was shadowing in my final year of medicine, the last few weeks before I started my first ever doctor job, it was nothing like actually working as a doctor. Because you've got random nurses coming up to you with random queries that you've never read about in medical school. All these different medications, and you know, the best way to actually become a good doctor is by just being in the job. And then if you do get your work experience, make sure you reflect on it. Think of stories that have happened in that work experience, and use that in your interview. I think one of the pitfalls I fell into when I was applying the first 2 times is that I thought I could just quote unquote be myself, and just hopefully just get through somehow. But really, interview practice is essential, and in essence, it's kind of an act. You just got to maybe memorize a couple of stories from your work experience, and if they ask you a certain question, such as can you demonstrate any good communication skills from your work experience, make sure you have a story that demonstrated good communication skills. But if they ask you a different question about maybe empathy or teamwork, you can use the same story and just maybe rejig it somehow. So you don't have to memorize a story for every different question they could ask. But at the same time, don't memorize things word for word when it comes to the interview, because it just sound very robotic.
Yeah. Because you have to think of stuff that's going to make you different from, say, the person standing next to you in the line.
That's true. But at the same time, you don't want to be too different. You just have to be kind of an ideal candidate. You have to be passionate about medicine, be willing to work hard, sacrifice your time with your friends or family, and really care about other people, because that's one of the big things.
Yeah, and I think one of the things that helps students now is the fact that actually the demand for medical students is increasing, and the amount of cohorts is increasing in a lot of universities. And I don't know if you're aware about the 2 or 3 new medical schools opened now. So Kent's got its own medical school opening from the next academic year, apparently. Kent and Canterbury Medical School.
Is that a private medical school?
No, I think it's not.
Okay.
I think
There's a few private medical schools.
There is, yeah.
And I think that's going to increase competition for jobs, but at the same time, we do have a lot of vacancies, and I don't know. It takes a long time to train a doctor, so we're not going to see any immediate effects. But I can see the rota gaps at the moment. So there are a lot of gaps that are unfilled, and a lot of the time we have to get locum doctors in. And even last year I locumed myself just to fill some gaps at my local hospital. So yeah, overall the demand on a medical student is quite high. You have to really realise that as a student going into medicine and being a medical student, it's arduous, it's long, there's a lot of hoops to jump through, a lot of paperwork to complete, as well as all the medical knowledge you have to kind of accumulate and transcribe onto the exam paper. But something I do have to admit is I think medical school doesn't really help towards becoming a good doctor, because no matter how much book knowledge you have, it's not going to make you a good doctor. There are some universities that are traditionally more academic, and I don't want to name any names. My university, Barts, was obviously, even though we had to do our book work and academic stuff, it was very communication skills heavy, and they made sure that you could look after a patient and be able to communicate with them as well as your colleagues. I think that's probably more important. So I don't think medical school really helps in the sense of giving you knowledge, because even the most senior doctor looks up guidelines now and then. But being a good doctor involves you being organised, being nice to people, both your patients and your colleagues, listen to the nurses, just basic people qualities. Especially when you're stressed, you can't lose your temper with anyone. So yeah. Yeah.
Well, when you started training as a medical student and where you are now, is this how you imagined a doctor to be, or is it completely different to what you thought it would be?
Oh, that's a tough question. To be honest, I took every day. I didn't really. I knew I wanted to do pediatrics from very early on, and I kind of knew what it could be like, but nothing will prepare you for your first day on the wards, even in pediatrics. Even when I was a very junior doctor, being a junior pediatric doctor is completely different, and just the added stresses, the added challenges you can never really prepare for. And I think even as a 16, 17, 18-year-old, when I was applying for medicine, I don't think anything can really open your eyes as to what the life really is like. And that's the problem with some people. They're pushed into medicine, they have this idealized vision of what being a doctor is like. Maybe you're pressurized by members of your community or family into going into medicine, and they haven't really got a great vision of what being a doctor is about. They always think about the prestige or how it will look like with the rest of the community. But it's more than that. There are so many things that you don't really think about.
Yeah.
Just dealing with things like death, people with severe illness. Last year I worked for 6 months on a stroke ward, and the things you see, previously fit and well people suddenly just losing the ability to talk, to walk, to use their hands, to swallow a lot of the time. You can't really prepare for things like this, and you just develop the thick skin as you go along. I think things are magnified much more in pediatrics as well. You see suffering in adults, and obviously that's bad, and you want to help as much as you can. But because children are suffering and potentially dying, there's just that magnified urgency or stress, as well as the parental stress that is on your shoulders. I don't know if that's answered your question.
Yeah, no, it has. And when you applied for medicine, were you local from London? So is that why you applied to London?
Yeah, I lived in London. Yeah. I was living in northwest London, but I had to commute to the east, so it was in Whitechapel. Yeah. And some of my placements are a bit further east as well. Okay.
Because a lot of students don't really look out. So essentially, they just apply. So people who live in London just apply to London universities, People who live in, say, the Midlands just apply to Midland universities. But essentially, you should always have an open mind, essentially, where you want to go. Because the standard of teaching is obviously more or less the same, because it all falls under the GMC guidelines. But I think people do hesitate moving away from home when it comes to universities. Obviously, because you're from London, you didn't really experience that a lot. But I think for prospective students, it is quite important to emphasize the fact that there are many universities outside London as well. A lot of people try and get into London, and it's good because London is probably one of the hub of the country, essentially. But there's amazing standards outside, like Manchester, Nottingham, Keele University, where I'm from, a lot of different universities, and essentially they should always have an open mind of where they're applying, so don't constrict themselves to within London, where the demands or the amount of people applying is really high for the amount of seats available, essentially.
Yeah,
and I think that's an important topic, isn't it?
Medicine is medicine at the end of the day. If you've got your degree, you can pretty much work anywhere in the country. If you do live outside of London and want to get into London, you have to think about the financial cost as well. You're going to accrue a massive amount of debt by the time you graduate. Some people just want to, again, apply for the prestige, quote unquote. They think that getting into a certain university is going to look better on their CV. Ultimately, not really, because the application system for speciality training as a doctor doesn't really look at which university you went to.
And that's the same as even for foundation year program as well, isn't it?
Yeah, foundation program, speciality training. Yeah, it's a nationalised system where they just look at your exam results, your ranking in medical school, as well as 50% is something called SJT, which is a situational judgment test, which gives you certain scenarios, and you have to kind of rank what you would do in response to certain things. And that is 50% compared to, 50% of SJT, and then 50% is your medical school of 5 or 6 years of training. So it's a massive exam. So yeah, there is no real, you don't really have to look at universities far from you if you want to get into medicine. I would recommend trying to stay at home as well. You get your food cooked for you, clothes cleaned, and you'll save a lot of money in terms of rent and things like that.
That's quite important, and hopefully that's quite useful for people who are maybe thinking about doing medicine. So we've also got listeners who are doing medicine currently at the moment in different universities, and obviously you've got some in the higher years who are now looking towards foundation years. You've been through the foundation year program.
Yeah.
Have you got any tips for the students who, like, what sort of specialities they should apply for foundation year? And what sort of stuff should they be concentrating on doing foundation year to help essentially their future perspective into whatever training program they want to go into?
So, depending on who's listening, you may have already decided on a certain career path. The first hurdle is deciding whether to do medicine or surgery. I think if you want to do surgery, you already have that mindset from very early on. You've probably filled out your portfolio. You've probably got loads of publications already. If not, don't worry. I'm personally not a fan of surgery, even though it's important. I can't see myself standing in an operating theatre that long doing the same kind of procedure over and over again. I wanted something broad. So in paediatrics, you've probably pretty much covering all of medicine in people of different age groups. So you're covering all of medicine in neonates, newborn babies, and then you're covering medicine in slightly older, like kind of toddler age, and then children, 9-10-year-olds, and then you've got the teenagers, pretty much adults. So you're covering all of medicine. I really wanted a speciality that I didn't want to lose any knowledge, more or less. And I always wanted to be challenged just by things I didn't know and things I needed to know. Obviously, in surgery, things are more practical in terms of techniques and things, and some people have an affinity to that. So either way, if you have a speciality you want to go into, maybe think about number one, you're still in medical school, so you can still have time to kind of explore if you really want to do that or not. So just speak to a consultant on your placement or in the hospital that you're currently on placement at, and just ask them if you can shadow them for a bit. That's what I did for pediatrics actually. In my third year, in my first ever hospital placement, I just went straight to the pediatric ward and I said, can I just see what it's like? And they said, yeah. And I think that's one of the big influencing factors, because everyone was really nice. They just let me just follow them. I thought, yeah, I like this. So you don't have to wait until a foundation year to decide if something is for you or not. I know a lot of colleagues and friends who were in FY1 and FY2, which are the foundation years, and they still didn't know what they wanted to do, in which case you can do a taster week, or just use your placements as an F1 and F2 to kind of iron out if you like something or not. At the end of the day, a lot of my colleagues just went for GP at the end because they couldn't really decide, and at the same time they wanted what they thought a good work-life balance. I don't know if that actually happened in the end. But ultimately you don't know what job you're going to get, because it depends on your ranking in medical school and SJT, as we previously talked about.
Yep.
And you'll just be given based on where you rank in with the rest of the people in the country. So yeah.
Anything that anything that you did personally that helped you during foundation year? So anything that you concentrated on to make sure that the specialty you get into, it might help you further on? Because a lot of people, some foundation years I know, take a step back, just do the minimal work, get to the program, pass the exams, call it a day. But you have some people who look for specific stuff that they want to make sure they get out of foundation year.
So personally, I'm not a very CV oriented person. I just do things I enjoy doing, and then get bits of paper proving that I did them, and I just put them in my portfolio. I don't really, I'm not really a portfolio driven person. So in medical school, I got very involved in pediatric related things just because I enjoyed doing them. So Teddy Bear Hospital, is a society where the students go to schools and teach 5 to 6 year olds about germs. We show them medical equipment, and they bring in their teddy bears. We make them better and things. And it's just a great tool to promote health in very young children. We also talk about dental health with them as well, but that's a separate topic. So yeah, and it also alleviates any fears the children have of medical professionals. So I did things like that. I tried to organise extra modules in paediatrics. I in my final year I did like a 2 or 3 week long paediatric rotation that I self-organised just to see what it was like.
That's good.
And my elective as well, which is usually around 6 to 8 weeks, where you go to a different country after you finish your final year exams. I did that in Zimbabwe.
Oh, nice.
I did paediatrics there.
Nice.
It was amazing.
Why did you go to Zimbabwe?
Good question. I still can't believe my mum let me go for a month to a country I'd never been for. I don't know anyone there.
Did you go alone?
Yeah.
Oh wow.
Can't believe it. Thanks, Mum. She was probably stressed out the whole time. But reason I went because most of my friends went to Malaysia, places like everyone goes to Malaysia because it's chilled out and I think you can get signed off very quickly.
Yeah.
But I did mine properly. I spent all my time in the hospital. I think I went to Victoria Falls during a bank holiday weekend. And that was amazing.
Wow.
But the reason I went is because everyone spoke English there.
Okay.
And I heard it's one of the safest countries in Africa. And the Menk family as well, Mufti Menk.
Oh yeah.
He's from Zimbabwe.
Yeah.
And I knew where his mosque was, and I thought, let's just see. I didn't meet him, but I met his whole family. I met his brother, I met his dad, his son.
Yeah.
It was amazing. And then I went again 3 years later just because I missed it.
Oh wow.
And I rode an elephant both times. So yeah.
So you really made the most out of your elective, didn't you?
Yeah.
Okay.
So really just take initiative, that's what I would say. If you really want to do something, just explore. In my FY1 year, I did a taster week in paediatric palliative care, just to get an overall broad range of what paediatrics is really about. And I still liked it, so I just went for it and applied. And there we are.
That's good. So what we'll do is we'll go for a short break, and when we come back we'll discuss a little bit about baby growth, essentially, and a little bit about vaccinations. And then there's a couple of interesting topics I want to end the show with. Essentially, what we mentioned before about Quran circles, and a couple other things as well. So just to remind everyone, if you do want to call in, it's 0333 444 0940. That's with any question you've got about getting into medicine, about medical school, or even any health questions, whether that's adult related or pediatric related. We'll try and answer them and give you a bit of education that we can as well. So inshallah, we'll see you soon after the break.
Inshallah, 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 you'll find your way. Inshallah, 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 you'll find your way. Every time you commit one more mistake, you feel you can't repent and that it's way too late. You're so confused, wrong decisions you have made haunt your mind and your heart is full of shame. But don't despair and never lose hope, 'cause Allah is always by your side. Inshallah, 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 you'll find your way. Inshallah, 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 you'll find your way. Turn to Allah, He's never far away. Put your trust in Him, raise your hands and pray. Ooh, yeah, Allah, guide my steps, don't let me go astray. You're the only one who can show me the way. Show me the way, show me the way, show me the way. Inshallah, 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 we'll find our way. Inshallah,
Bismillahir Rahmanir Rahim. Welcome back, everyone. So, we're just going to carry on the show with essentially what I want to start off, what I want to talk about now is just going to diverge a little bit into pediatric health, essentially what you're doing at the moment. I want to talk about baby growth and why it's important for parents to take care of a few things, especially during the first year, especially. So, do you mind explaining what we mean by baby growth and how what parents can do to make sure that the baby's growing well?
Okay. So, I'm still in my first year of pediatrics, so everything, all these concepts are fairly new to me, but I've seen enough babies to know that some babies are born very tiny, and that's due to factors within the mother's womb. Sometimes it's the mum's diet, maybe the mum smokes, which is really a factor that irritates me. Sometimes the placenta isn't healthy, or maybe there's some infection or something going on as well, and that's affecting the growth inside the womb. When the baby comes out, one factor that affects growth that we really need to look at is feeding. But one way to monitor growth is to just weigh the baby and measure their length as well. We mainly look at weight within hospital because mum is now feeding the baby and it's all new to her. Maybe she's not producing enough breast milk, or maybe baby's not latching on properly. We need to monitor weight quite closely. But when the baby is discharged from hospital, the health visitor should be following up quite regularly, and every so often they should be weighing the baby and measuring their length. And what they do is plot it on a centile chart. And any parent out there, I'm not a parent, but I've seen enough red books to know every baby has a red book. And in that red book you have these centile charts, which are kind of curved lines. Oh, you can't see me, I'm on radio.
But no, actually, Facebook and the YouTube stream can see you.
You've got these curved lines that go upwards. I'm going to try and describe in words.
Okay.
And on the x-axis, on the bottom line, you've got the age, and as the baby gets older, you are plotting the weight and the height, or the length, along these centile lines. And what you're aiming to do is to have these plotted points within the same couple of lines. If there is a drop in the baby's weight or baby's height, you will see that on the centile chart, and then some intervention should be made. Either a dietitian needs to get involved because baby may not be feeding on the right things at the right time, or maybe not enough. So the dietitian probably needs to calculate calories and whatnot, maybe introduce new things, but maybe there may be something underlying as well. So there could be an illness, maybe the child isn't absorbing or digesting the food properly, or the milk, depending on the age of the child. Maybe there is a metabolic condition which is fairly rare, but unfortunately becoming a bit more popular these days. So these are just things we need to think about when it comes to growth.
And you mentioned feeding, especially in a newborn. It's basically two options essentially. Either you can breastfeed or bottle feed.
Yeah.
And previously there was a big push towards bottle feeding because of all these big milk companies, the advertisements and stuff like that. But now, even as medicals, we're pushing parents towards saying breast is best essentially.
Yeah, that's right.
Do you want to explain a little bit why breast milk is better than... Obviously, if it's a situation where you can't breastfeed due to problems that are outside your control, that's a different issue. But why should you always try breast first before you go on to bottle feed? So
the World Health Organization recommends that every baby should be exclusively breastfed in the first 6 months of life. So from birth until the end of 6 months, baby should just be getting breast milk, ideally. As you mentioned, there are some factors that are out of our control, and maybe mum can't produce enough breast milk. Maybe baby has a tough time latching onto the breast. Some people say that tongue tie is an issue. Tongue tie is where there is a little membrane or a little bit of skin underneath the tongue, and it prevents the tongue from moving properly. Some of my consultants think that's nonsense and tongue tie doesn't really affect feeding. But either way, we do kind of say you should get it snipped, or see someone about that tongue tie. Sometimes the mum just doesn't want to breastfeed. it's uncomfortable, it's inconvenient sometimes.
Time consuming as well, isn't it?
Sorry?
It's time consuming as well.
Yeah, I wouldn't know
Yeah.
personally.
Oh yeah.
I've never I've only been the recipient of breast milk,
Okay.
and that was a long time ago. But for whatever reason, sometimes breastfeeding isn't appropriate. I know midwives love to push breastfeeding. Even when the baby's losing weight, they tell the mum to persist with breastfeeding, and sometimes that's when we see them in hospital because they've lost a lot of weight. Every baby actually is expected to lose weight in the first 10 days of life, up to 10% of their birth weight. If that happened to us as adults, if we lost 10% of our weight,
That's important.
we would be seriously unwell. But babies are built that way, so we do expect babies to lose weight within the first 10 days of life, but not more than 10%. But if they say it's day 3 or day 4 of life and they've already lost 10%, there is something going on there. So we need to look at if the baby is well or unwell. I'll probably get some medical attention by this point. So the midwives usually are quite good at referring babies who are losing quite a lot of weight. So if the baby is well, we need to look at their feeding, and sometimes they're just not getting enough breast milk, and that's when we would consider formula milk. Formula milk is not evil. I know formula companies want to make as much money as possible, and they try and advertise whenever they can. Contrary to popular belief, we don't get any money from breast milk company. Doctors don't get any money from formula milk companies, but they do try and advertise their companies, at our events and things. But I don't think that really has much of an impact. We just follow hospital guidelines, and whatever the hospital guideline says in terms of brand of milk, we probably just give it. There are actually some premature babies who, some babies are born premature when they come out too early, and mum just can't produce milk. And in that case, you wouldn't just leave the baby to starve. Sometimes you can think about donor breast milk, but other times we just have to give formula milk just to help them grow.
Yeah.
I would not recommend giving cow's milk to a baby, a newborn baby, because the protein and fat content and all the different salts is not what a baby should be getting. Sometimes it's too high, sometimes it's too low. Ideally, breast milk contains all the nutrients and antibodies as well. So breast milk really protects against, the evidence shows it protects against kind of chronic diseases, against things like eczema or asthma. It helps foster a bond between mum and baby, and also helps the mental health of mum as well as helping mum lose all the extra baby weight.
Yeah. Another thing that people don't persevere is the fact that they only give it a few hours when the baby's born. If the baby doesn't latch on, to start giving bottle-feed milk. But generally, babies can go without feed for, I think it's 48 hours, isn't it?
I don't know if it's that long.
Mm-hmm.
Maybe in the first bit of life, I think we do recommend maybe 12 hours without feed isn't disastrous, but they do need to start feeding fairly regularly. So in the first few days / weeks of life, they need to be fed 2 to 3 hourly, and then maybe 3 to 4 hourly a bit later on. But yeah, initially mum will start producing something called colostrum, which isn't the proper milk, but it's very protein rich apparently, and it helps baby get into it, kind of thing. But yeah, if it'll take a bit of time for the milk to properly come through, so yeah, you can keep persisting, but if baby is starting to become dehydrated, you need to think about alternative sources.
And if parents do want to get more education on this, where should they go? Should they talk to the health visitor a bit more? Go back to the GPs and stuff?
So everyone should have a health visitor when the baby's born. They should be the first port of call, and if they are concerned, they will escalate it to the hospital. And we see a lot of babies in A&E with feeding difficulties, and weight loss and jaundice as well. I think you talked about jaundice last week.
Yeah.
So jaundice is a very common problem, but weight loss is equally quite bad. And any baby that comes in with feeding problems, weight loss, we need to think about any other reasons for that. It's not only just because they're not getting enough breast milk. There could be something more serious going on.
Yeah. Okay. That's fine. The other thing that we wanted to talk about quickly, I know we touched on it last week with Dr. Nadia Rafiq. We had a conversation about vaccines, and I know you're quite passionate about this as well. And I'm sure every pediatric doctor out there is passionate about vaccines. And in fact, you mentioned that a few days ago you had a case where, which is due to the fact that can happen due to vaccinations, essentially, or people who don't have the vaccinations or putting other children at risk.
So I don't know if passionate is the right word, but I'm just very angry and upset when a child comes in and I find that the parents are very anti-vaccine. So you've come to me asking for medical advice, but you're not going to take my advice when it comes to vaccines. And sometimes they come in with vaccine preventable illnesses, which makes it equally or more infuriating.
Just before you go in, anyone who's got any questions about vaccines, like any misconceptions about vaccines,
any concerns, anything at all,
they're more than welcome to call in, and Dr. Fatine can try and answer them, because he's looked into this quite a lot, and he's tried and he's looked at the most common misconceptions people have about vaccinations. You're more than welcome to call us on 0333 444 0940. Sorry, carry on.
Can you say the number again?
Yep.
Fast.
0333 444 0940. Or you can write down on the Facebook live stream, or
okay. Vaccine is actually, I have three kind of aims in life, in my career, and if I fulfill one of them, I'll be delighted. And one of them is ending the anti-vaccine movement. I understand parents want the best for their children. I understand there are a lot of concerns out there, a lot of YouTube videos and websites of people saying that vaccines are not safe. I find those websites misleading and wrong, and sometimes fraudulent. Vaccines are essential, in my opinion. Just because we don't see the rates of polio in the past, or I don't know, serious measles and things like that, doesn't mean vaccines don't work. It's because vaccines have worked so well that people are starting to have doubts about them. So really it's a victim of its own success. Actually 2 days ago I saw measles for the first time. And even though I was buzzing, I made the diagnosis. I was really worried about the other children in the A&E department who hadn't been vaccinated, the babies, maybe the immunocompromised, the ones whose immune systems aren't very strong. I worry about them, because if they pick up measles, it's going to be much more serious than in a kind of a normal, healthy child. People think measles is a very benign or non-serious condition. I really wouldn't wish measles on any child.
Definitely.
It makes them very uncomfortable. The rash is very bad, and there are serious effects that could happen, including brain damage, not only immediately or within a few days or weeks, but years. So there is something called SSPE. I don't know if you've heard of it. I think it's subacute sclerosing panencephalitis, and this only happens in measles, where 6 to 10 years later, after you've had measles, and it's all gone, you start having progressive neurological and deterioration, and you ultimately die. Just these things could be avoided just by a vaccine.
And a lot of the vaccination, the diseases that vaccinations cover, essentially, a lot of the diseases that vaccinations do cover, most of them do cause neurological deficits. Hence, why the vaccinations are firstly in place anyway. Yeah,
definitely. So, a few strains of meningitis are covered by vaccines. We've got polio. We've got. I don't think we don't vaccinate for chickenpox, but in many other countries, they vaccinate for chickenpox. Yeah. Because chickenpox can actually have neurological impact as well. Actually, one of my consultants who did their training and work abroad has never seen a case of measles or chickenpox before.
Oh wow!
So it's crazy.
Yeah,
it's coming back as well. Measles is
on the rise.
Outbreaks everywhere.
Mm-hmm.
It's really sad.
Yeah. Well, I hope that educates a lot of the people out there about vaccinations and why it's important to make sure that the vaccination schedule that the Public Health England has released for children at specific months to give out vaccinations is all done through evidence-based, essentially.
And in Islam, we always have to look at evidence. You know,
Definitely.
قُلْ هَاتُوا بُرْهَانَكُمْ إِن كُنتُمْ صَادِقِينَ. Bring your evidence if you're truthful.
Yeah.
You can apply that to religious text and debate, but look at everything else in life.
Yeah.
You don't just follow a random person on the internet because they say, oh, this vaccine did this to my child. Just follow the evidence, basically.
Yeah. Because I'm sure Public Health England won't put vaccinations out there that put children at risk, because that's bigger strain on the NHS of having children come in with medical problems.
Exactly.
Then vaccinating children, even though vaccine itself is a big cost.
And there's this conspiracy that it's the drug companies that are really pushing. They benefit from vaccine, and obviously they make profit from the vaccine they create. But at the same time, they will profit more if a child is seriously unwell in the hospital, because we've got to pay for their hospital stay, all the medication we've got to give them, and equipment.
Yeah.
So think about that as well.
Yeah. And so in the last 10 to 12 minutes that we've got left, I want to talk about something that you mentioned last night, actually, that I didn't know about as well, about these Quran circles that you carry out in West London. Do you want to elaborate a little bit on that for me, please?
Okay, very fine. So, alhamdulillah, I've been given an ijazah by a teacher who's now back in Saudi. He just came to do his PhD.
Mashallah.
And he was great. He just did lessons for us every week, free of charge. And he just made sure that I continued that tradition. So in West London every week, near Hanger Lane, if anyone's interested in joining, feel free. Maybe just message.
Yeah, you can message me and I can put you through to Yasin, yeah.
But we just do a weekly Quran lesson for people of different ages, different levels. Some people are trying to memorize the Quran or parts of it. Some people are learning how to read Arabic properly. So there's lots of different levels, and we try and perfect recitation of the Quran, basically. And anyone's welcome to join.
What days do you do them?
Friday evenings, usually at 7 p.m. It's at the Zain Foundation, which is on Abbeydale Road near Hanger Lane.
Okay. If you drop me the details, I can drop that with the radio team, and if anyone wants to get in contact, they can get in contact. We
have a WhatsApp group because sometimes we change the time.
Yeah.
And it's very chilled out. A lot of doctors actually come.
Oh, mashallah, that's good.
Obviously, it's completely flexible, so if you can't make certain weeks or months for some people, it's not the end of the world, and it's quite chilled out. We go to eat afterwards and stuff.
That's nice. Good. And the other thing I want to talk about, and I think this is quite an important topic, especially these days, with the whole Islamophobia and sort of the image that us Muslims have in workplaces generally these days in the Western society. How was life for you as a Muslim in university, and how is life at workplace, especially during Ramadan? Because obviously, you get asked the most common question: not even water.
Oh yeah, not even water. That has actually happened, man. It's not even real.
Well, I had someone who asked me that can you even cook food during Ramadan?
Oh, okay.
And I was like, that's the first actually that cooking food during fasting. Okay,
that's crazy.
But yeah, how's life been as a Muslim during university and in workplace as well as a doctor in obviously quite a big university and hospital?
Ultimately, I think it's all about who you surround yourself with. Alhamdulillah, at university, I met some amazing brothers and sisters who I'm still kind of in contact with. Even though we're doctors now, we rarely have time to meet up. It's all about who you surround yourself with, and even the hadith, al-mar'u ala dini khalilih, a person is on the path or the religion of their friend, who they consider as friends. So, I met some great people, and I was part of the MMD, which is Muslim Medics and Dentists, which is the ISOC. They've now called it ISOC officially.
Oh, have they?
Yeah.
Have they changed the names? Oh, okay.
Because I think there are a lot of non-medics and dentists who are now part of the campus.
Ah, okay.
And I just got involved in Charity Week or just all these different events. And that's kept me busy, spiritually and physically.
That's good.
And I went to my weekly Quran lesson from my third year of med school. That's when my teacher started teaching me. And that, alhamdulillah, obviously my family and friends have just kept me, well, we could be better Muslims, all of us could be better Muslims, but alhamdulillah, I still consider myself a Muslim. I still try and do the obligations, in my daily life. And there are a lot of people who have fallen off the path. A lot of colleagues and things, they were kind of considered, they considered themselves Muslims, but now I don't know what they would consider themselves. I think that the challenge is especially apparent in when you start work, because you're not really surrounded by. You can't really choose who you surround yourself with in terms of ISOC or whatever, and you're just out in the big bad world. There's no one there to remind you when to pray. No one's really watching you, kind of thing. Obviously, Allah's watching you.
Yeah, definitely.
But you haven't really got that kind of support network or anything. You're just by yourself, and a lot of people are living by themselves or away from family or friends. So there is that temptation to just, you can do anything, and no one's really gonna know. Try and meet some good, good Muslim colleagues at hospitals. Try and just stick with them, and as I'm kind of doing with my weekly Quran circle, there is some contact with Islam and things like that. Obviously, it could be better, but have some link with Islam and a reminder. And
I think that's quite important, especially medicine itself. It's quite busy. The timings are long. The days are you have to work quite regularly. You get really short breaks. We have to do all your errands and stuff like that as well.
Yeah.
But it's really important to stay in touch with Islam.
But at the same time, your daily work life is a reminder of how grateful you should be. There are so many people suffering there, and there's so many things we take for granted. Like, I just wake up, put on my clothes, brush my teeth, eat my breakfast, go to work.
A lot of people don't have that.
They can't do that. They can't get out of bed. They can't eat. They can't swallow. They can't use their hands. So your work should really be a reminder of how grateful you should be. And one bit of advice I'd give to my Muslim doctor colleagues and non-Muslim as well is just have ihsan in everything you do. Ihsan just means like be excellent, be the best you can be in everything you can do. I want people to look at you, and if they were to be asked, who's the best doctor that you've ever worked with, I want them to think of you. Be reliable. Don't be kind of mundane. Don't be average. You're there to be the best. And Allah's put you in this position to be the best. So don't flop.
Because they always say you always get out as much as you put in, essentially. So the more you put in, the more you're going to get out of it, essentially. And I think that's a very, very valid point.
And one more thing I just want to say.
Sure.
But being a good doctor, as I said, isn't about book work. If you speak to patients, or I've overheard patients sometimes, they say, oh, he or she is a really good doctor. It's not really about what medication they gave or what it's actually how they felt or how they were treated as a person. So just be nice to everyone. That is my number one advice to doctors.
That's a really good advice.
People will say that was a really good doctor just by them being nice.
Yeah, if you speak to a lot of patients, the biggest thing that I pick up on it is how was the doctor towards them? Did they come in, greet them nicely? How did they speak to them? Because regardless of whether you're able to treat them or not, if you're nice to them, they'll remember, oh, do you know what? He dealt with me in a nice way. And that's with anyone down the road. Like, if you go to a shop and you always remember the guy who was nice to you.
Yeah.
So
it's simple human interactions. A lot of us are failing.
So in the last few minutes, I just want to quickly ask you, why did you choose pediatrics? I know it's your first year of training. How's it been, and why pediatrics? Why not GP that you touched on before?
A GP is great because you get pediatric patients as well.
Okay.
But I need to be moving around and stuff. So there are massive challenges with pediatrics. I'm a person who enjoys challenges, and I'm stimulated by them for some reason. So there are a lot of challenges regarding communication. Sometimes you can't communicate with a baby. You're trying to find out what is going on. And you have to be communicating with people of different ages. So parents who are quite anxious, sometimes you're trying to read what they're kind of thinking. Sometimes you can talk to the children and try and find out what's going on and try and get on a level with them. So there are challenges regarding communication. There are challenges with procedures, because if you want to take blood or put in a cannula into a child, it's not as straightforward as it can be in an adult, because they'll be struggling, screaming, etc. And you need to think of distraction techniques or holding really firmly.
Yeah, no. When my little one had to put cannula, when my little one needed a cannula, literally everyone walked out of the room. They were like, "We can't watch this."
How old was she?
She was a few weeks.
Okay, when they're a few weeks old, they still don't really know what's going on. You can overpower them by just like holding them.
But my whole family couldn't bear watching it, so I just walked out.
Okay. I haven't got the emotional. I can do it. It's fine. But you get a real buzz when you manage to get a cannula in like a 10-minute-old baby, tiny veins. So there is that as well. There are loads of procedures you do in paediatrics that anaesthetists are expected to do in adults. So things like intubation, long lines into arteries and things like that. So it's very hands-on. You need to know a lot, and there are massive challenges regarding communication. There are obviously downsides as well regarding kind of safeguarding and abuse of children, which you see sometimes, and it's heartbreaking. But there are things that really rile me as well. Things like parental smoking, and I know this is a big topic as well, but cousin marriages. It's big in a lot of communities, and I know the kind of quote-unquote advantages of cousin marriages, but I think there are a lot of disadvantages as well. I think what the Ashkenazi Jewish community do, because it's a very small community, they haven't really got a good pool of marriage potential, is they do genetic counselling before they even get married to the person. So they know if there are any diseases they may be carrying, and if the child will come out deformed. Because I've seen so many cases of children just being born very unwell, or even later on, 1-2-year-olds.
And these days genetic counselling is quite common as well, and it's easy to get referred to genetic counselling just to make sure everything's fine before a person commits to marriage as well.
Yeah, it's really important. I've seen, there was one couple in my hospital, they had 3 children. All of them had fingers and toes missing, but they still came in and they were having a 4th child. I was thinking, maybe just, take it easy. Focus on the 3 kids you've got now. There are some kids who come in, we've got no idea what's going on with them. All their blood results, every single blood result is deranged, from blood count to liver function, kidneys, clotting, everything. And we find out what parents are related. So it's really important to just, I know the marriage game is tough. But think about maybe broadening your horizons.
Someone just asked me a question. During your medical schools, and we're going to close it on this essentially, and I know we're running a bit out of time, but I'm sure you'll be all right. During your medical school, what was the one case or one mistake that you made? Because obviously we all make mistakes. That's part of human nature. What was the one mistake that you made that's really helped you in your future career? Helped
me?
Yeah, that you learned from the most.
Oh, okay. I make mistakes every day.
That's part of human nature, isn't it?
It's really important to admit to your mistakes when you're a doctor, especially when patient care is affected. You should never kind of brush aside a mistake and ignore it happen, because number one, it'll get picked up, and number two, patient safety is important. In medical school, I don't really remember I was never in a position to make mistakes, really. But I remember one mistake I talked about in my paediatric interview is when I accidentally prescribed one type of antibiotic rather than another. So there's a type of antibiotic called ceftriaxone, and I think I prescribed cefuroxime instead, or the other way around. They're very similar antibiotics, but the second I did it, or I realised, I felt really bad. And I thought, I can't, what do I do? So I spoke to my senior. He was really understanding. He said, it's fine, don't worry, they're very similar anyway. But I then told the patient as well, because that's one of the processes you have to follow. Tell the patient the mistake has been made, and they were fine about it as well. But I reflected on it, and I still make mistakes every day. Not as bad as prescribing errors, but the nurses pick up on mistakes before anything happens. Pharmacists pick up on mistakes, and you have a safety net kind of in place. So it's okay to make mistakes. So don't feel disheartened if you do make one.
As long as you reflect on it and try and ensure that next time.
Admit to it, and every single person, the most senior consultant, still makes mistakes.
No one's perfect.
And misdiagnosis happens all the time. So it's all right.
Well, that brings to a conclusion the second health show that I've done. And next week I've got Dr Adil Iqbal, who is acute medicine consultant down in Medway, who'll be with us, and I'm sure we've got a few interesting topics lined up for you again. But what I'd like to do is I need to do a quick shout out, because Muz and Irfan, who they're presenters on Revive FM, and they're doing a 10k run tomorrow essentially, and they're raising funds for this radio station, because you all know that this radio station is going to go live 24 hours, 365 days a year. So essentially they're doing it to raise funds for this radio station. So the target's £5,000. I'm not sure where they are at the moment actually. But even if 50 people can give £100 each, we can reach our goal. And the bank details on screen on Facebook that you can see wherever I am. But yeah, just a quick shout out to them. Secondly, I really want to thank Dr Yasin Fatine. He's travelled all the way from West London to be here with us today. Sorry? Luton, actually, yeah. And that even makes it an hour and 10 minutes further away.
I just want to Jazakallah khair for having me. It's been amazing.
Anytime.
I'm sorry if I say anything upsetting or wrong. Always happens.
It's fine. It's all part of medical knowledge, and I'm sure, and hopefully we might see you again next year. Who knows? But Jazakallah khair for coming down. I really appreciate it. Inshallah, I'll see you all next week. Till that time, take care. Enjoy the next 7 days of Ramadan until I'll see you again. Take care, and assalamu alaikum wa rahmatullahi wa barakatuh.
All the love songs in the world, and every